Yeah, it's a pleasure. Thank you very much, everyone. My name is Mariana Schweitzer, and I'm very glad to be here with my co-author, Fernanda Schweitzer. We'll present ourselves, and we'll talk today about the well-being, cultivating well-being and self-care, how we have been doing this to empower learners through life skills and integrative practices in online education. We're both from Brazil. I am here as a Fulbright scholar, visiting UCSD. I'm at the Public Health School and Longevity. And thank you, no problem. It's important coffee, very important. And it's my pleasure to present today this work that we have been doing since 2020 in Brazil. My background, I am a nurse and I work with traditional medicine. And Fernanda? Hi, thank you for staying with you, being with us. A little bit nervous, but not every day, right? And I'm a physician, I'm an occupational health physician in Brazil, and also dedicated to integrative health. So together we try to combine both medicine, nursing, and other specialties to this research we are presenting for you today. Thank you. And I am a teacher in the medical school of Universidade Federal de São Paulo. And in 2020, especially because of the pandemic, we saw a group of students and colleagues from the university wanting us and talking about well-being. So we're going to show you today what we have been doing to promote the well-being and self-care for these groups. Okay. But first, we want to invite you all to come to Brazil. Maybe, if you want. Brazil is a beautiful place, like here, and we're gonna have this wonderful conference in October of this year in the city of Rio de Janeiro. It's a beautiful city, it's very, very easy to invite everybody to come. And this congress, it's focused on traditional complementary integrative medicine. That's our main area, as Fernanda was saying, we work with integrative medicine, so the concept of well-being and self-care we present to you will be within this area. And we also published this book, Self-Care, A Dynamic Approach to Integral Health, and it's now in Portuguese and Spanish. So if you want to find out more about what we discussed briefly today, you can find in the website. Everything that we will show you today, it's for download, you can access, and we have all the tools we present to you in Portuguese, English, Spanish, Japanese, Chinese, Thai, and different languages. So please, if you think it's important, you can take a look. So today we're gonna bring up the concept of well-being, self-care, a method that we use, and also the self-care canvas, that's the tool we have been using, and a comic book, which is published in English too, to bring this, especially for young, and even young in the idea of 11 years old to 24, so it's a longer period. Yeah. So when you think about well-being, we think about the invitation the World Health Organization brings to us regarding the bends and the trends to promote health and well-being. For a long time, we thought that the best way to promote well-being is to prevent diseases. But we know today that it's very far and distant from when we think about well-being, because people live with the diseases all the time. They're part of our lives. So the invitation, the future will be dominated with what is considered in the old system radical, that is integrative medicine. How you combine, how you harmonize your body to be ill and to be healthy, and then you take care of yourself during this period. So this is the invitation WHO invites us to do, to think especially in the planetary health, One Health, and especially including traditional medicines that are, for example, traditional Chinese medicine, acupuncture, Ayurvedic medicine from India, or indigenous medicine. They're very popular in America, so we have been using these approaches. So when we think about the worker well-being, this is the invitation we get from this material that we understand that health status, work evaluation experience, workplace policies, and culture, this is all very important when we think about ourselves as a worker. And when we think this together with the concept of integrative health, this is the invitation we want to do to you, because integrative health is to get the best evidence, and we have been producing evidence maps about all these practices that are available to people to understand. There's lots of evidence for yoga, for acupuncture, for any of these practices, for treating back pain, neck pain, fibromyalgia, that's very difficult, complex diseases, chronic diseases, and people can include these as tools for themselves.
just to add, this worker well-being model from NIOSH has the same elements WHO model to health places to work. So we have a combination of two models we can apply to work well-being.
And when we think about self-care, we invite you to look at the foundation of self-care that invites us to think about the 7 pillars. And it's very complex because did everybody here slept 8 hours? Ate the amount of fruits and vegetables and weekly we need, or is today with your exercise routine. So this is very difficult to put in practice, but it's also very important to focus on the long term. And when we think about self-care, we understand it's part of a triad, and it's the self-knowledge you have about yourself, about the resources that you can use. So, I use only biomedical approach. Can I expand? Can I use more approaches? And it's also related to the cosmovision. Why do I want to be healthy? Is to work better, is to take care of my family, is to be an elderly, healthy patient. What do I want with that? So this triad is the invitation where we invited people to think about all of these pillars.
And Cosmovision brings also our critical view about all this health we are offered or receiving. And as we can adjust this to what we really need and not just what they want us to have.
And how we have been doing this. So in Brazil, at the university I teach, we have been doing this as elective discipline. We have been doing the editions of a course, self-care course for the community online. So me and Fernanda, we recorded 10 classes, and then we present the concepts of what is self-care, what is well-being, how can you promote it, what is integrative health, how can you use the evidence to promote, and also meditation practices, because we know it's very important for mental health, lots of evidence about mindfulness, and then we use these habits and we use these practices. And also we have the tools translated to English so people can use that. We have been presenting this workshop in English and Spanish and Portuguese in different places of the world, like Thailand, like Brazil and here. And also we have a research grant. We received a research grant from the Ministry of Health of Brazil to promote this with the youth. We know that the second cause of death between the youth people is suicide. So we need to prevent suicide ideation, and we know that promoting life skills, self-care, and emotional intelligence can really help. And we have presented 2 workshops here at UCSD for undergrad for the staff, and one workshop online for UCLA. So we have been promoting. And you don't need to use anything that we will present to you today, but we want to bring this experience and bring this invitation to think about the way you're treating yourself. So that's a good thing.
And in the context of WHO definition of self-care, that's a little bit new. It refers to the skills of individuals, families, and communities to promote health, prevent disease, maintain health, and cope with illness and or disability with or without the support of a healthcare provider. So we are being invited to, without support, also develop and manage our own health and well-being. And the concept framework for this is really huge, it's endless. But we can include this in our cosmovision to get more aware of what is more important to us in our life moments that always change. And to make this more concrete, we proposed this FEMA method composed by 4 steps: find, embrace, move, and again, begin again, okay? So we are inviting you to first find out what's going on, what symptom, discomfort, disease, or even what desire, interest you are looking for, and then also find health professionals or tools you can apply, models or rationalities you can also choose to guide your care, or try, and also help groups, virtual communities you can apply to your own health. So this is find out what's going on, what do I miss, what do I want, and what can I apply. Then the second step for us is the most hard to do, because it's about embracing, it's about connecting with something is uncomfortable and comprehend it's part of ourselves. It's inner, inside us, because usually people think, oh, disease, I want to cut it off. I want to out of myself. This is not mine. This don't belong. But the movement we are proposing, especially for chronic illnesses, is this is about yourself. What you choose, all your life, your genetics, your families, and embrace without judgment or blame. Not blaming yourself sometimes a little bit hard, but it's important so you can really manage this situation with universal ethics, gratitude, compassion, and forgiveness. These are life skills we are going to explain a little bit more later. Then the third step is about making movements, little steps. It's not about cure or healing that we also want, but it's about making a movement and let the body and the environment show us what to do and where are we going with these movements we can do. So rearrange, recycle, produce change. Change starts by choosing new goals and targets in relation to 5 health perspectives: physical, energetic, emotional, mental, and spiritual, or the perspectives you want, occupational, social, as you wish. And again, it's about comprehending it's not gonna necessarily end. Maybe we're gonna stabilize our problems, our situations, our illnesses, but then something happened and we need to begin it again. Okay? And to make it even more applicable, we propose this canvas with the 4 steps and some questions to guide your self-research, self-investigation. What feelings, emotions, illnesses do you want to address? What therapies can help me? What process or strategies don't seem to work? Change, move, try something different. This is available online for download for free, okay? And embrace is about connecting. So what's the meaning of the situation in my life? The limitations, but also, and very important, the opportunities I maybe have with this change I may do. Move is about changes that can help to reach my goal, possibility solutions, and how do I measure? How do I perceive it's changing really? And then again, how do I measure? I have to reach my goal. Okay, now I'm stable, I'm good, I can focus on something else. Which signs show me it's time to start a new cycle? When this begins again, just remember I'm not very good, I'm not okay, I need to think about.
And what we started to do when we started to present this to the students was that the students started to film and send it to us. And at the beginning they were like, do we need to do that? And we were like, yes, it's necessary, it's part of the curriculum. And by the end of the discipline or the end of the month, usually I stay with them, they're like, why took you so long? Why the university took it so long to bring us to us and to invite us? So this is an example of a student that brought this for his self-research. And then what we did was to put this in a comic book. And then to finalize, I'm gonna just show you the comic book where we invite the youth and their families to discuss self-care, and then also to discuss all the 10 life skills recommended by the World Health Organization. So every part of the book you can understand the concept, you can pass, for example, that concept, and then some exercises where you can build up, for example, your personal label, the SWOT matrix to, understand your weakness or your strengths, and then you can understand each life skills and then do some of the exercises, non-violent communication, and then the professors can work with this with the students in any discipline if they feel like. We have received colleagues from Spanish classes, they want to work this in the Spanish version and the professor in English version, and then they talk about it. And every part of the exercise, you can understand what is stress management, and we invite people to do meditation and a well-being calendar. So if you feel that this would be something that you could, invite people to read about it, and it's available, it's together with the Ministry of Health in Brazil, and everybody can take a look and think. And we always start with the night, because the youth always think this is the time for them to do what they like. And then the meditation technique is very simple, so anybody can do by reading it. And they tell in the story, it's very difficult. So, you can just start by breathing and then doing it. And then just the last one, we invite people to do, but we understand challenges are difficult. So we invite everybody to broaden their healthcare paradigms, try different evidence-based TCIM, traditional complementary integrative medicine practices, develop life skills, and develop self-care. So thank you so much for your time. And please, we have just one self-work if you want, so you can just put it for your practice if everybody can have access, and the self-care observatory also, where you have lots of tools. So this is not only us doing it, it's a whole group of people involved in this area. So thank you very much.